The pandemic has thrown the world a fresh curveball, and authorities are moving to counter the new challenge with comprehensive analyses, border controls, and fresh calls for public vigilance and vaccination. For more, I have Professor Chung Gi-seok from Hallym University. It's a pleasure to have you back, Professor Chung.
Thank you for having me.
I also have Professor David Kwak from Sooncheng University. Good to see you again, Professor Kwak.
Good afternoon, Sunny.
Professor Chung, I'll start with you. Now, prior to Wednesday's announcement of Korea's first 5 cases of Omicron infections, health officials on Tuesday spoke about looking into suspected cases after one sample tested positive for a variant that was not the Delta. Could you explain this for us?
Well, there is a very interesting and tricky story behind the finding of a first case in Omicron, Korea. As you know, there are several ways to confirm variants. The first one is whole genome analysis. That's the most accurate, but it takes time. And the second one is target genome sequencing. It's on progress. Still, you need to have a suspicion on that. But we are doing variant PCR from alpha, beta, gamma, and delta. But Omicron PCR is not established yet. But one officer in the laboratory center found that the suspicious one sample had a certain mutation. It's named N501Y. This is amino acid variants. Alpha, beta, gamma has that mutant. And also Omicron has that one. Delta hasn't, no one. So they found the patient has an N501Y variant. And the sample was proved to have no alpha, no beta, no gamma. So in that case, it's not Delta either. So they suspected to be an Omicron variant. And they started whole genome sequencing and found that that was the first case of Omicron in Korea.
Right, so it's all thanks to this one researcher at the laboratory.
Yeah, I think that scientist is very clever.
Right. And Professor Kwak, against that backdrop, now what are your thoughts on the possible transmission of this mutant virus, should I call it, Omicron, across the community?
Well, so this was the first case that we found, and we're mainly concerned if this first case actually could become a cluster infection because they have been supposedly exposed to many different people already. But I personally don't think it will be the first ever case that happened in Korea. As many of the global countries are already reporting, they're suspecting that it has probably been going on for several months already, and they found traces back to possibly sometime in October and in November, possibly in some of the European countries, which tells us that it is also possible that it has already intruded into our country as well. So if we're to seek even further and maybe find or dig up the domestic cases of its genomic coding and PCR for specific codings for Omicron, I think there's a chance that we might also find it even within our domestic cases. So for this incidence only, would it, if you're asking me if there's a possibility that this might turn into cluster infection, I would say yes, there is a chance that it may become a cluster infection, but I would also add that there's also a chance that other cluster infections could possibly be happening already from the Omicron variant as well.
Right. And Professor Kwak, just out of curiosity, what are the chances of infection faced by the other passengers on the flight back to Korea from Nigeria shared by the married couple? Because they were in a flight that probably included, I believe, about 40 passengers.
Right.
Are they all at high risk?
I wouldn't necessarily say so, because up until now, it has been very rare that passengers who shared the same ride in the same plane were infected from a passenger who happened to be on the plane. I think it's partly because the plane itself is negatively pressured. So it creates an atmosphere where there's lesser chance for transmission to occur among passengers. But it doesn't completely exclude any possibilities at all. So I cannot guarantee that there's no chance for any of the passengers to have been infected. But I would also think that it's still very rare of a chance if there is any.
Right. Professor Chung, the global health body, for its part, has denounced the latest travel bans imposed on southern African countries in light of the Omicron scare, of course. What are your thoughts on this, and how or what do you propose to deal with the current situation?
Well, it's quite urgent globally and domestically So WHO document in that, they say that if you close the border, then illegal entry will occur and people smuggling will occur. But it only applies to certain countries like many inland borders. But like Korea, we are like an island. So we have a border with North Korea, which is very strictly closed. And neighbor forces and sea coast guards, police are working very well so far. So there is a very low chance of people smuggling into our country. So I think we cannot prevent the inflow of Omicron from now on. It's been already in our society, but it's very important to postpone the inflow and postpone the circulating viruses number in here, because we saw about 10% increase every week of Delta variants starting from July until beginning of September. It's now at 100%. If Omicron predominates, and that will take a month or 2 months from now on, that we have to postpone and delay the predominance of Omicron if it is very serious, if it's more transmissible, and if it is more toxic. We need more data on that, but I really insist on strictly controlling the border until we find everything about Omicron variant.
Right. And Professor Kwak, there is widespread belief that our current vaccines and treatment options may be less effective against Omicron. What are your thoughts?
So the speculation is made based on science pretty much, actually. And different pharmaceutical companies that have also made their own statements that they also expect their own treatment regimen or vaccinations to work less efficaciously against Omicron were it to happen in clinical cases. But I actually dug a little deeper into the statements, and none of these treatment regimen or the vaccines have thoroughly or formally studied against particular Omicron variant yet. So there is no formal study that backs these statements up. These are only statements and speculations these responsible people have made so far. I believe there was an exaggeration by a certain number of media outlets that turned these statements into something that was formally based on a formal study, but no, those are not true. But rather, these are really speculations that these people have made. But speaking of which, this speculation is also scientifically grounded, however, because the number of mutations this Omicron currently carries makes it vastly different in their spike proteins, which the antibodies that these vaccines formulate, also antibody treatments that different companies come up with, are targeting. So if they change morphologically due to several more different mutations being made on that specific protein, obviously the antibodies we fight against these viruses with is not going to be able to attack as much. So it makes sense that we can anticipate lesser efficacy from the current vaccines or the treatment regimen that we currently have at hand. However, it does not mean these vaccines or antibodies will not completely work at all. It doesn't make it obsolete. So as these pharmaceutical companies also state, we still have much better chance of fighting even the new variant with the vaccines rather than without them. So we still have to iterate the fact that most everyone still needs to get vaccinated if they haven't already yet, but also if they require booster shots, then they would strongly recommend it to do so.
Right. So the information we have right now about the efficacy of our current vaccines or treatment options are educated guesses. Would that be a logical way of looking at it?
That would be a logical way of thinking it. Oh, it's only an educated guess based on the fact that there are so many mutations made on the variant, but no clinical studies have been done so far on this particular variant.
Right, Professor Kwak, understood. Professor Chung, in the meantime, Korea's daily tally is hovering on the 5,000 level. The number of severe cases stands well above 700. Do you expect these indices to rise further?
Sure. I think it's like a snowball. So if pretend RO, reproduction number, is 1.2, and we were seeing 100 patients several months ago, last year. And if RO is 1.2, it transmits to 120 people. But we are seeing 5,000 daily cases. If our is 1.2, then 6,000 people will be affected by 5,000 people. So it's a tremendous number, but the government keep its own position. It insists on going forward, not stepping back. So while the medical supporting system is on nearly paralysis, and in some parts it's collapsed. So I had a chance to talk with a critical care professor last night in our hospital, and he said the survival rate these days is very low because the patients are coming in a very bad condition compared to the previous one. That's mainly because they were waiting too long before get to ICU. The disaster, some part has already happening in ICUs and in sub-ICUs as well. So all I want is please the government to take some action. Either go back to level 4 social distancing level, or either to expanding the vaccine pass in some other facilities, not only in some gyms and some indoor facilities, but also in other places. Particularly, the vaccine pass should be applied in any place where people take up masks, whether they are eating, drinking, or etc. In those places, the vaccine pass should be applied. Then we can partly prevent the tremendous spreading of Omicron virus or Delta virus, whatever.
Professor Chong, having said that, what are your thoughts on expanding the vaccine passes to teenagers who are right now exempt from the pass themselves for cafes and restaurants?
Yeah, I think it should be applied as well because they are prone to have some side effects due to vaccination, but still they are each individuals who can transmit their virus easily to other people. So apart from essential places like a school, 학원, and some other places, then unnecessary places should be applied for even children. They should require a vaccine pass. It's just for the time being, and not forever. Just for 1 month or 2 months will be appropriate. So I strongly insist on applying a vaccine pass in children and young boys and girls.
Right. Professor Kwak, on the vaccination front then, some 80% of the population has either received the Janssen vaccine or 2 doses of other COVID-19 vaccines. What are the implications of this reality now as we face rising caseloads and Omicron?
Well, many different factors. The vaccines that we have received so far is not entirely up to par with the types of vaccines that were given to many different other countries. So even though we have reached up to about 80% in the total population to have completed some sort of vaccine type, it doesn't necessarily mean that they're all sharing the same efficacy in regards to prevention of the virus. But in regards to booster shots, it all being the same type and showing very great efficacy, I think it's going to give a rather much higher boost in creating immunity among the population. Now, that being said, from my personal experiences, because in my own clinic, I have to give many different antibody tests to people who are planning to leave the country. And I noticed strongly that people who received proper shots within our country to carry antibody levels. But for those people who actually came into our country from a foreign country who has received a certain different type of vaccine that is not given in our country, were much more likely to lack antibody levels. I want to set it as a base that antibody levels does not necessarily equate to the level of protection from the virus, but still it shows something that the type of vaccines that are given currently would be anticipated to be much better in its effectiveness and efficacy against fighting against the virus than the ones that were given to other people, or the different types of vaccines that were given to us as well. So we have to consider that factor in regards to the coverage of 80% of the total population. Now, once going back to the booster shots again, since the booster shot is going to only remain in a type of a vaccine, I think it should be given to most everybody within the nation. And if it is so that we need to give it more frequently, let's say we need a second shot of booster shot, and maybe let it be, because vaccines clearly, I'm a little hyper today. It clearly prevents vaccine or viruses from spreading to others, and it also clearly prevents people from becoming severely ill in the progress of the disease. Of course, it's not 100%, but in most everybody. I have a brother who works at an ER. He's an ER doctor, so he sees, as Dr. Jung mentioned, what's going on currently. He sees up to 3 to 4 deaths every day being caused from COVID-19 cases, and that hasn't ever been done before. So we're faced with a very dire situation. Currently, the only regimen of treatment that we have at hand is through vaccines. So and he's also mentioning, my brother is also mentioning, there's a drastic difference in clinical symptoms of people who had been vaccinated or against who haven't been vaccinated. Obviously, those who become much more severe are the ones that haven't been vaccinated. So I once again iterate that everyone who is eligible for vaccination should receive so.
Right. And staying with the concerns within experts in the critical unit center, like you mentioned, your colleague who talk about concerns of patients arriving with aggravated symptoms of COVID-19. Having said that, Professor Jung, what are your thoughts about at-home treatment, which will be the standard procedure for COVID-19 patients here in the country?
Well, I don't agree with the at-home treatment policy in Korea, particularly because for some people, like Singapore adopted, young, having no underlying disease, having completed vaccination with mild or no symptom, could be stayed at home, and they can be monitored. But Korea, the government decided to keep all patients at home. That is a principle, he said. And in that case, what about the very risky patients? An elderly patient with underlying disease like diabetes, hypertension, chronic lung disease, and etc. So is there any transfer system well organized for emergent cases? There's no. Is there enough doctor to call to each patient at home every day, and day and night? And who can take care of that? Having experienced more than 30 years of pulmonary medicine in my field, I cannot decide well just by calling any patient without seeing patient. We have to touch the patient, see it in eyes, and we have to listen to a stethoscope and etc. So I don't think this is good for anyone. So I again strongly recommend our government to change their policy. It could be a disaster for some people.
Having said that, Professor Jung, very briefly speaking, what would you suggest as an alternative then to deal with the rising caseloads that Korea faces at the moment?
Well, once I said yesterday, we have to establish a hub hospital, big building, host any kind of COVID-19 patient, from moderate to severe and very severe in sub-ICU, ICU, and general ward. And all patients who have to be stayed at home can be transferred to that specific hospital in certain area. So there is no need to call here and there to one doctor, to another, to one hospital, to another, to begging for a bed. So the hub hospital establishments, I really strongly recommend.
Right, and that was something you said last time you were here as well.
Yes.
All right, Professor Jung, as always, thank you very much for your thoughts. And Professor Kwak, as always, thank you for your time and your thoughts.
Thank you.